Cox Business Television.
Welcome back to Cox Business Television. Improvements in information technology are being looked at as a source of great savings in healthcare. In fact, the American Recovery and Reinvestment Act includes $20 billion for health IT. That improves the quality of healthcare, and it also reduces duplication of services and limits errors. So what will that technology look like, and what will it mean to you and to me? Joining us now to sort that out is Bert Reese, the CIO at Sentara Healthcare. Thanks for joining me.
Thank you.
Bert, with all the talk of the stimulus dollars, it seems that EMRs, or electronic medical records, are kind of at the centerpiece right now. Could you help kind of tell us what is an EMR and what does it really mean to us?
Sure. Well, one of the engines under the economic reform or the healthcare reform is the electronic health record. And the purpose is to improve clinical quality and reduce cost. And in the Sentara experience, we have found that to be true. As a patient, when you see your primary care doctor, your specialist, the ED, or the hospital, you'll know that you're under electronic health record because the provider is using either a laptop or a workstation in order to care for you. Sentara currently has 6 of its hospitals up in electronic medical record, 280 physicians, and about 7,000 patients using a remote portal to help access their care. One of the things that Sentara tried to do, and has done it very successfully, is to have one technology across the continuum. So at home, in your primary care, in the specialist office, in the ED, med-surg, and ICU, it's all the same technology. So you can move very easily across the continuum and your record goes with you. And that's a great value both to the clinician as well as to the patient.
Okay, and I think I heard you saying a second ago, but let me follow up. As a patient, how do I play in that electronic medical record? Can you help me understand more?
Yeah, sure. More directly, with your patient portal that you have at home, and in one of the previous segments we talked about wellness and alerting people to do the right thing. The portal has the capability to notify you, the patient, and your caregiver that it's time for your particular exam. So your prostate exam, your mammogram, those type of things. The computer can keep track of and remind everybody that it's time to help keep you well. Okay. The other thing that the portal can do is allow you to have email exchanges in a confidential way with your provider, your doctor, in order to promote your care.
That's cool.
You can schedule your own appointments. You can get results online, and really a really special feature of the portal is that it has an intelligent agent that, based on the drugs that you have and your clinical profile, it searches the internet for education materials to help you guide yourself on your care and your family members. So it's a very, very powerful tool.
That sounds like a really amazing opportunity, and that's where technology probably can be leveraged if you can pull all of those different aspects into somewhere that someone can access as easy as a laptop.
And I got to tell you that it's probably not known by the community, but Cox is instrumental in making this happen. As you know, over the last 5 to 7 years, we worked with you in your engineering department to put the metropolitan infrastructure that's under the streets to allow us to move the clinical data at a high-speed, confidential manner in order to make this all happen. And so we, Sentara Healthcare, and the rest of the provider community, as well as the business community, is riding over your network, and we appreciate all the good work you did on that.
We thank you for that. Thank you for that lead-in. And Bert, I know you're involved both locally but also on the statewide perspective, but how is Virginia, and more specifically, how is Hampton Roads positioned really to make this transformation with IT and with the EMRs? Sure.
I will tell you that all your hospitals are working on the electronic health record, and they're trying to bring the physicians along. This is a dramatic change both for the hospitals and for the practices. Simply put, in the case of Sentara, both the hospitals and the doctors are paperless. That's a really big change. So I think it's the obligation of the hospitals, once they have their strategies in place, is to reach out to the physicians who practice at their hospitals in order to bring them along on their journey. From our view, it's sort of a motto of better together, everybody going to the same place. And our data has shown that these electronic health records will improve care and they will reduce cost.
And as a business owner, every physician probably has to be concerned with the cost impact as he makes this transition. Is there mechanisms in place to help those doctors make this transition?
Sure. Clinically, in the systems are these clinical alerts. So if you have a more cost-effective, clinically rich way in order to treat the patient, you can alert the caregiver at the point that they want to render the care in order to give them an idea what the right thing to do. From an employer's perspective, those wellness programs, the ability to alert people to keep themselves well, that helps reduce the incidence of disease. The other thing that we're experimenting with Optima Healthcare is the ability to do e-visits.
Okay.
So if we can do e-visits from your desktop, that means the employee doesn't have to be out of work as much. So the combination of taking duplicate tests out, improving the way we care for patients, will all help reduce costs, hopefully premiums and the cost of care.
So, I mean, it sounds that IT really now plays a dramatic role in the future of healthcare, and you all are right at the center leading that.
And with your help, you help us get us there, and we appreciate it.
We thank you guys. I thank you very much for being here today, and thanks for your service to our community.
Thank you, Mike.
Thanks. Coming up next, the very latest Publisher Spotlight, a report from our friends at Inside Business. Don't go away.